Good morning, everyone, and thank you so much for joining us for today's webinar entitled Trusted Voices in Medicine, Helping Constituents Navigate Vaccine Information. I'm Candace DeMatteis. I'm the Vice President of Policy and Advocacy for the Partnership to Fight Infectious Disease, and I'll be moderating our discussion this morning. We're so grateful to have so many congressional staff, health policy leaders, reporters, and stakeholders join us for this important conversation today. Vaccines continue to be one of our most effective tools for preventing the spread of infectious diseases and serious illness, hospitalizations, and even deaths. Yet the environment in which people are facing these choices and making decisions about vaccination for themselves and their families really has never felt more complicated. There's a lot of mixed messages out there. And amid that noise, physicians, nurses, and pharmacists and other frontline clinicians remain among the most trusted sources of information and personal confidence in making those decisions. Recent polling has showed that 9 in 10 voters want vaccine guidance to come from doctors and medically trained public health experts. So we're excited to bring those voices into this conversation for you today. We are joined by physician leaders who have served both in the exam room and in public office. They understand what people are asking about and how policies and debates in Washington and at the state level can either support or undermine access to vaccines, those choices that we can make, and trust in the systems that recommend them. Over the next hour, we're going to focus our conversation on 4 major goals. First, we're going to talk about hear from clinicians what they're seeing and hearing from patients and constituents about vaccines, and candidly, their colleagues maybe as well, to explore practical ways to provide clear, medically grounded information, to discuss how to steer people toward credible sources for information and away from misinformation, and how to tell the difference. And finally, to consider what members of Congress and their staffs can do to protect access and informed decision-making when it comes to vaccines. This is intended to be an open, constructive, nonpartisan conversation centered on the medical evidence and personal needs. You're welcome to submit questions at any time in the chat function, or I think it's actually in the Q&A function, and we'll share them with our panelists to answer in real time. Most of all, we hope you see these panelists and the Partnership to Fight Infectious Disease as a resource for ongoing work with your offices and in your communities. With that, it's my pleasure to introduce our panelists. First, Dr. Jerome Adams is an anesthesiologist and the 20th Surgeon General of the United States, who served during President Trump's first administration. Dr. Adams previously led the Indiana State Department of Health, overseeing statewide responses to crises such as Ebola, Zika, and HIV. He now serves in academic and advisory roles focused on public health, health equity, and emergency preparedness. Thanks for joining us, Dr. Adams.
Glad to be here with you today.
Next, we have Dr. Larry Bucshon, who is a cardiothoracic surgeon who practiced for many years before representing Indiana's 8th District in the U.S. House of Representatives from 2011 to 2025. In Congress, he was a longtime member of the House Energy and Commerce Committee and a leading GOP Doc Caucus voice who advocated for patient-centered health policy and innovation. Thanks for joining us, Dr. Bucshon.
It's great to be with you today.
Last but certainly not least is Dr. Michael C. Burgess, who is an obstetrician gynecologist who practiced in North Texas for nearly 3 decades before serving as a U.S. representative for Texas's 26th district from 2003 to 2025. During his tenure in Congress, he held key roles on the House Energy and Commerce Committee and GOP Doctors Caucus, and helped craft major health legislation, including measures affecting Medicare payment, health insurance coverage, and medical innovation. Thank you, Dr. Burgess, for joining us. I'm going to jump right in with questions. Again, if you do have questions, please use the Q&A feature at the bottom of your screen. It feels like we'd be remiss not to start off with a quick look back to last week and the most recent meeting of the ACIP, or Advisory Committee for Immunization Practices, which, as most folks may know, makes recommendations about the vaccine schedule that the CDC director then accepts or rejects, and then that rolls out to states. the outcomes last week were pretty profound in many ways. Dr. Adams, I want to start with you. How can people make sense of the discussion and the votes and what it means for people going forward as they make decisions for themselves and their loved ones?
Well, again, thanks for having us here today. And I would say that we faced some enormous challenges over the last several years and up to and including last week, not only from infectious diseases themselves, but also from polarization and confusion surrounding how we prevent them. What I've learned, both from caring from patients and from serving as the 20th U.S. Surgeon General, as well as from listening to communities across the country, is that people are not opposed to health and they're not opposed to science. They're opposed to feeling unheard, rushed, or dismissed. And we saw a lot of that sentiment come out and play out, particularly last week at the ACIP meeting. I think one of the things that we need to do is really focus on communication. There's really a gap between what public health agencies think they've communicated and what the public actually hears. And in regards to the Hep B vaccine, which was one of the big changes from last week's ACIP meeting, you saw that play out. We haven't done a good job of explaining to people why the United States is different than Sweden or Germany or Finland. For one, and it's interesting. Before we started, we were just talking about this with former Congressman Burgess. Texas is bigger than a single state is bigger than entire countries, most countries in Europe. And so when we're dealing with larger numbers of people, when we're dealing with much more diverse groups of people, you end up with different policies. Those other countries also have better, quite frankly, and more complete healthcare infrastructure and access. That means more access to doctors, more regular access to opportunities to ask your questions, less opportunities for people to miss necessary vaccinations. And when people feel like we're not giving them the full story, then you see the pushback that we saw last week. So I'll wrap up by saying one of the things I think we all collectively need to do is listen more, simplify more, and meet people where they are, not where we wish they were. So I'm not opposed to the idea of individualized and personalized decision making, shared decision making. I will point out that that's always been the policy. The policy wasn't the problem. It was that there are some examples that people have brought up where that shared decision making and autonomy was not respected at an individual level. But the policy change, from my standpoint, unfortunately, creates a lot more confusion for the public and for providers.
Several great points, and I want to turn to our other panelists. Dr. Bucshon, let me start with you. So there's so much information out there, and I'm sure that that probably has changed over the course of your practice of medicine with the internet and just the social media now taking over by storm. There's so much information. Where should people go for trusted information? I mean, can they turn to their physician? Should they be turning to their physician? What do you tell people when they ask you these questions?
Well, I think at the end of the day, they need to turn to their local provider. I mean, in their community. As Dr. Adams pointed out, our communities are very diverse and different, and so across this country. And so I always tell people, like during the COVID pandemic, right, when to convince people to get vaccinated, talk to your local physician because that's their job to understand what's happening in public health. Many do, I mean, there's challenges there, and whether they all do, I understand. But I suggest to people talk to your internist, talk to your pediatrician, talk to your OB/GYN physician in your local community whose job it is to be up to date on what the current medical recommendations are, not only from federal agencies, all right, from state agencies, from international agencies, and then come up with the best decision that can be made. So that's what I encourage people to do.
And I just want to second that. Again, context, the recent Texas measles outbreak. You're going to make a different recommendation, perhaps, to your patient if you're in the midst of an outbreak in your community than you are if you're someplace else at the moment where things are calm. So to foot stomp what Dr. Bucshon just said, it's important that we really focus on empowering physicians, pharmacists, nurses, and patients to have that individual conversation, because vaccines don't succeed because of what's said from a podium in Washington, D.C. They succeed because of what happens in exam rooms, in pharmacies, and community centers at the local level all across America.
Dr. Burgess, let me turn to you as an OBGYN. I mean, you're on the front line of a lot of this. Pregnant women have a lot of questions. I know I certainly did when I was expecting my children, and there's a lot of you're excited, but you're also nervous, and there's just so much information out there. I'm also curious about how these shifts and contrast with recommendations coming from American College of Obstetrics and Gynecology, for example, or the American Academy of Pediatrics. So again, how do those shifts in national recommendations affect frontline providers, and what can be done to ensure that we don't limit options and access for patients, that they get information but also access?
Well, let me just start out by saying when you look at the vast panoply of infectious diseases that are now vaccine preventable diseases, that 150 years ago would certainly shorten the national lifespan. I mean, I can't say I watched all of the ACIP meetings in September and last week, but I watched a good portion of them, and it kept crossing my mind. What problem are we trying to solve here? And I don't know that I ever really got a good answer to that, but I do know this, recognizing the landscape that as it exists today. And I realize that the CDC director or acting director will still have to rule on the ACIP recommendations, but I don't kid myself. That's going to be largely consistent with what the health secretary wants. But now it becomes much more incumbent upon, of course, us as doctors and patients who look to us for advice. It's going to become incumbent upon patients themselves to become better informed and make good decisions. You got to go back to the point that well, a lot of this is fallout from the last administration and from the COVID epidemic, but President Biden's insistence that everyone take a COVID vaccine when the data was incomplete. And then when the data changed during the course of the illness, they didn't change their position. And they ever came back and said, well, we thought this 2 months ago, but now it's different. And Larry and I remember this. We were in Congress, for heaven's sakes. We in the House were required to wear masks on the floor of the people's house, but senators were not. And I don't know what it was,
That's
what
right.
was so protective about the rotunda of the Capitol that it stopped the virus, but it was like we lived in completely different worlds. Well, people are understandably reacted to information that was inconsistent, sometimes turned out to be provably wrong, and there was never any sort of comeback to from the CDC. We want to level with you about what we do know and what we don't know and what might change. So the CDC itself had a lot of repairing to do. Now, unfortunately, this has happened, and prior to any repair of credibility at the CDC, we now have an entirely new milieu into which we're all thrust. But it becomes important for doctors to become very conversant about this, and it becomes important for patients. And in the case of newborn hepatitis, it becomes important for moms and dads to become conversant about this, ask the right questions.
I think he
I
froze.
think Dr. Burgess froze there for a minute.
Yeah.
Can I just comment on some of the things
Yes,
you've been saying?
please.
I
No,
think
Oh, there
I
he
know
is. He's
he's
back.
back.
Sorry. You froze for a minute, Dr. Burgess.
my specialty is defensive medicine. I know for a fact that if there is a child where the mom's hepatitis B surface antigen is not known, and the child does not get protection and then subsequently develops a very devastating disease, there are going to be writs filed and torts made, and that will be a big deal uh, because what had happened in a previous world did not occur.
Great point. Dr. Bucshon,
And
you
I
wanted
think
to add something?
another
Oh,
challenge
sorry.
is when we attack when we continue to sow doubt from high levels on the safety of vaccines, the long proven safety of vaccines, then that lowers confidence and causes more people to opt out. And that to me is a concern that I have. Congressman Burgess, Dr. Burgess, you couldn't have said it better. What problem are we trying to solve here? And what are the consequences of what we're doing? And the more we lower vaccine confidence, the more we're going to see outbreaks. We had 2 children die of measles this year. We had the largest number of measles cases in 30 years. We had 2 children die of whooping cough. This is just unnecessary. There are better ways to get at educating the public about how to opt out, how to have conversations about let's have an educational campaign with providers about how to respect patient autonomy and have better conversations. But let's not change policies in a way that sows doubt in vaccines and actually verifiably and certainly will harm kids.
Yeah,
Dr. Bucshon?
can I
Mhm.
comment also more globally about the confidence of the American people in a lot of our traditional institutions, right? This isn't just, I think, loss of confidence maybe in the federal government, but you look at law enforcement, you look at faith organizations, you look at your grandparents, your elders. I mean, I think that to a certain extent, we need to do a better job, of um, educating people about these institutions and why it's important to have faith and understanding about in the medical field, particularly about recommendations coming out of the federal government, realizing these are recommendations and your local physician or your providers need to assimilate those into their practice and understand those. But what I saw, I think, during COVID, and Mike talked about that, Dr. Burgess talked about this a little bit, in my congressional district, rural America, right, is when, and I think Dr. Adams talked about this, when people were discounted and their questions weren't answered and they felt like they were being mandated by institutions to accept medical therapies that maybe they didn't understand as well as they should, and maybe their providers didn't because the data wasn't quite there yet. That has spilled over into now, I think, traditional vaccination, childhood vaccination, and others. From the COVID experience, people saying, well, if the federal government was kind of telling us, we should do this, and the data wasn't maybe what our providers thought it should be at this point, well, maybe that's also what's been happening with the other vaccinations, and now we should question those. So I think it's bigger picture. I think we need to regain the confidence of the American people. People, I've found in general, when it comes to healthcare, can understand their circumstances if explained to them and addressed to them respectfully. But when you try to have institutions mandate either for or against certain medical therapies or give recommendations that are not clear or are different and changing frequently, then you're not going to be in a good circumstance. And so I think that's the fundamental problem we're in.
One thing you all raised great points, and I want to follow up on that. One comment that is commonly repeated on social media and was raised in last week's meeting is that we really don't have great data on safety. But candidly, personally, I found that really confusing because many of the recommended vaccines, including the one, the Hep B dose that they were talking about last week and the Hep B vaccine, they've been around for more than 30 years. So, and has been given to millions of people, maybe even hundreds of millions of people, even in the US, in that time frame over 30 years. So, do we have the data or not? I mean, what were you basing your recommendations on as physicians if we don't have that data? Is that an accurate statement or was that misleading?
I mean, I'll start on that one if you don't mind.
Sure.
I think we have decades and decades of data, right? The problem is in healthcare, and I've experienced this in my own practice, is anything that you do in healthcare, there are some people that will have adverse reactions to treatment. Whether that's vaccination, whether that's open heart surgery. I mean, no matter what I did, statistically, a certain percentage of people have complications, infectious complications after surgery, no matter what you do. I mean, but for a variety of reasons, every patient is different. They have different, and their health outcomes can be different. I think that's the challenge. To me, it's where people who are not favorable to vaccines for philosophical reasons are using very, very rare occurrences and acting like these are very common and that the government just isn't telling us. But we have decades of data to show that that's not true. We have safety data, but there will be people that will have horrible complications from being vaccinated or other medical therapy, and but the numbers are really, really small, and they're being honestly, I think it's being taken advantage of to frighten people and make people question the safety aspect of these.
It's so much harder to quantify harm that has been avoided or averted than it is to quantify harm that you can see, and that's the challenge we have. It's a statistics and a human visibility problem in regards to vaccines. You can't look at a kid and say you didn't get measles or you didn't get hepatitis because you got vaccinated, but you certainly can look at an individual, no matter how rare, who has experienced vaccine harm. And there's nothing we give. I'm an anesthesiologist. We've all worked in the operating room. If we give you too much oxygen, if we give you too much normal saline, IV fluid, we can harm you. There's nothing that we give you that is without harm, but it's all about risk and benefit. And on the childhood vaccination schedule, we have more safety data than on almost any other medical intervention. Childhood vaccines and the schedule as a whole are studied more rigorously and in larger populations than virtually any other medical product worldwide given to children. And it's not just the vaccines individually, the schedule itself has been studied. Researchers have looked at whether giving multiple vaccines on the same day affects the immune system, neurodevelopment, or long-term health. All these things have actually been studied. That said, it's completely reasonable for parents to ask whether giving several vaccines on a schedule is safe. What the evidence shows from independent academic researchers, from international data, from long-term surveillance systems, is that the schedule does not increase the risk of developmental delays, autoimmune health, chronic health problems, or concerns like autism on a population level.
A great point. The one question I had, oh, Dr. Burgess, did you want to chime in?
Just the observation that these are not benign diseases that we're talking about. And
Yes.
a problem that we have is a lot of people are 1 or 2 generations removed from having ever had to see these diseases up close and personal. I mean, the last child I saw with congenital rubella was as a medical student back in the 1970s. I mean, no child is born with congenital rubella syndrome anymore because of the vaccination program. But I promise you, you don't. It's so bad you don't want it to happen once, let alone multiple times.
Thank you for that. The risk of these illnesses, it's far higher than the risk associated with following the vaccine schedule. And that's why the schedule exists in the first place. So I'm so glad, I really just want to emphasize to anyone who's watching that we have a cardiovascular surgeon who sees the impact on a particularly vulnerable population when vaccination rates go down. And we have an OBGYN who has spent his life studying this. And for me, I used to run a state health department and would see the population level data when we saw vaccination rates go down. So you're hearing it from 3 very different perspectives, but we all very much believe in the overall societal benefit of vaccinations and the current vaccination schedule.
You all raised such an important point of when we talk about harm reduction, it's, tens of thousands of cases, but it does seem further removed from someone who did suffer an adverse event or a vaccine injury, because that's an individual. You can put a face to it versus the faceless, if you will. But also to your point, we do have a history. We know what happens when we don't have access to these vaccines. And maybe it is leaning in on talking to people with that lived experience, older Americans and who've had that lived experience and know what these diseases could do, or physicians who've treated it. Unfortunately, Dr. Burgess, you mentioned congenital rubella. I understand there was actually a case this year in Florida for the first time in a long time, tragically. One thing I want to talk about too is how different communities who've had different experiences, and maybe even these days, even political affiliations, it almost seems that, it's gotten political, whether you believe in vaccines or not, and have different levels of trust in the health care system. So, Dr. Adams, I'm going to start with you. How do you adapt your vaccine conversations to be sensitive and responsive to those realities? And after Dr. Adams, I'd love to hear from Dr. Bucshon and Burgess. Like, if I'm a congressional staffer and I'm fielding these calls, how do I handle that dynamic?
Well, one of the things I always try to work into a conversation is a sentiment that I live by. People need to know that you care before they care what you know. And Congress, Dr. Burgess and Dr. Bucshon said this earlier. When people talk with a clinician they trust, those politics, they melt away. When we see people in doctors' offices, we don't ask, are you a Republican or a Democrat? And our patients don't ask us that. They just say, Doc, what should I be doing? What should I know? How do you think about this? And we should be empowering local health professionals to continue to have respectful, personalized conversations that really break through the one size fits all national messaging on either side that we often hear. That would be my best advice to folks, is talk to your doctor, your pharmacist, your nurse, because they know you. And don't listen to Facebook. Don't listen to Twitter. Don't listen to TikTok, because these are people out here, in many cases, who are profiting in some way, shape, or form, either from the attention or because of direct financial support that they're getting, by leaning into fear, anger, and mistrust to keep you engaged and keep you clicking.
Yeah, always your doctor is your best source of information because they're the ones who are going to see you through if you have a problem. So it's in their best interest to keep you on the right road to health.
Yeah, I mean, I would agree with that. I think one of the things that has also, maybe I'll speak to rural America again, led to challenges for different patient populations is rural America right now is struggling in healthcare and feel like they're being left behind, right?
Yep.
And so and that's why when I was in Congress, I worked on legislation to try to make sure that clinical trials, were the people that participated were consistent with the population of the United States, whether that's rural America, urban America, or ethnic or racially diverse populations. And we need to do better in that. And be honest with you, during COVID, that was one of the things people tell me. They were like, well, yeah, they did these trials, but they did them in New York City or LA, but here I am in rural Indiana. I mean, how do we know that these things apply to me? I mean, that's a legitimate question, I think. So yeah, we need to do better and explain to different to populations about and it being inclusive so that people feel confident in these institutions that are making these recommendations.
And I don't want to get political, but I do want to tackle the elephant in the room. The MAHA movement is tapping into something real, to Dr. Bucshon's point. America is unwell, and we can see it. We can see it when we look around us. We are not well. Our life expectancy is down. Chronic disease is up. People feel like the system isn't listening. And on that premise, RFK is absolutely right. And you could understand why people would say, okay, what we're doing isn't working. Here's the concern I have, and where I sound the alarm. It's in taking legitimate concerns that the public has and boiling them down to single villains or single bullet solutions. If we just get rid of Tylenol, if we just get rid of this vaccine dose, then we're magically going to make society healthier again. Complex health problems don't have one cause, and they definitely don't have one solution or one savior. And so I think we need to be careful about oversimplifying, spreading distorted or incomplete information. That doesn't empower people, it confuses them, which brings us back to local conversations with your local providers who know you and who you trust.
All great points. I'm not trying to make this political, but we are heading into midterm elections. So that's going to be important. And polling shows, and PFID has done polling, as well as numerous others, that most Americans want continued access to vaccines. They also support routine childhood immunizations, and even a majority support mandates on both sides of the aisle. Now, there's some discrepancy in terms of the vehemence of that support or level of that support, but majorities do support it. But given recent federal level decisions that could limit or complicate that access, what role does Congress have to play here in ensuring transparency, in exercising oversight, and ensuring that consistency in decision making and that access is preserved? Dr. Burgess, do you mind if I start with you on that one?
No, it's important for people to understand that there are no federal mandates for any vaccine.
Yeah.
I mean, the Biden administration did flirt with it with COVID and monkeypox, but there are no federal mandates, and so it has to be seen from that context. Now, states do make a number of decisions, public school districts make a number of decisions, but that's on the local level, as it should be. As Larry correctly points out, there are different circumstances that will affect different populations. But by design, in our system, the federal government is not supposed to be a top-down, thou shalt get or thou shalt not get. It really is left more to local health departments and to state departments of health, like Dr. Adams used to run. I would all just say to Dr. Adams' point, as a family member who has someone in the family who's been affected by autism, this is a significant problem. And if someone has an answer, then I want them to shout it from the rooftops, but bring the data, bring the information. I mean, this is a big problem in the country, and I would not for a second deny that. But to Dr. Adams' point, there's not going to be a single, oh, this is it that's going to prevent any future. If you've got that, you darn well better have the data to back it up, because I promise you, there's a ton of people out there that are hungry for that information.
Absolutely.
Yeah, I
And
mean,
research too.
I would say from a congressional standpoint, oversight of federal health agencies and stuff is part of our role. I mean, they're funded by the Congress. The Congress appropriates resources. And so I think because of that, oversight is an important aspect of that. But I agree with Dr. Burgess that most of these decisions ultimately are not federal mandates. They come from the state or local levels. And that, in my view, that should continue. But I do think that appropriate oversight of federal agencies that are being funded by the American people is a substantial role that Congress should play. And when it comes to healthcare, I always like to see bipartisan issues discussed in a reasonable way. Now, and that sometimes doesn't happen. Let me just tell you, most of the time, the oversight occurs on some of these agencies like HHS when the secretary comes to the Hill to talk about their budget, right?
Mm-hmm.
I mean, Mike will tell you this, and that's where it's generally never about the budget. It's about all the other issues going on at a federal agency, when we bring the secretary up there. And in my view, I always thought that to be insufficient. We should have more oversight. And we do, don't get me wrong, but I think a lot of times it's oversight that is partisan, where one party who's in control of the Congress will bring some people from the other party who are in control of the White House up to Capitol Hill, not for what I would call legitimate oversight, but for partisan discussions, which I think we need to try to get away from that. And look, that's our system, but we need to do more oversight. That's what I see as Congress's role.
Mm-hmm.
Personally, Mike Burgess, what do you think about that?
You're correct, and it needs to be legitimate oversight. And it's not just in the hearing room. There's a lot you can do just discussing things. And I know Dr. Adams and I talked at several occasions about things during the heat of the COVID epidemic when it was occurring. I will also share with you that during the 4 years of the Biden administration, I could not get a phone call answered from anyone in a federal agency, anyone, Department of Labor, Department of Health. It didn't matter. They were not returning my phone calls. And for a portion of that time, I was a committee chairman. I mean, that's uh, that's a problem when the administration is not talking to Congress.
And I love this question. I think we have some congressional staffers here today. Number one, I would say know your data. So when I was state health commissioner, I loved when Congressman Bucshon, Health LA, would call me up and say, "What's going on in our district?" In our legislative district. We worked very closely on issues, and I wanted to make sure he had the data that was relevant to his constituents when he was making decisions back in Washington, D.C. So make sure you, as a congressional staffer, are reaching out to your state and local health departments to find out what's going on in your district to keep your member informed. Strengthen local infrastructure. Vaccines don't give themselves. And so you can focus on supporting the infrastructure that makes vaccination easy for people who want them. And that is a concern that I have, that we're actually seeing vaccine infrastructure being taken down. Continue to champion clear, consistent, and depoliticized messaging. You all are writing talking points for your bosses. Stick to the evidence, avoid partisan framing, elevate local trusted voices when you're talking about vaccines. Stable, predictable funding. Again, as a health commissioner, I can tell you when funding is going up and down, it makes it really hard as a health director to plan your vaccination strategies and campaigns throughout the year. Encourage data infrastructure and transparency. It's really hard if you can't track what's going on in a community to be able to respond to it or to inform the public appropriately. We saw this during COVID. And it's a big point I continue to bring up. Bad data leads to bad decisions. No data leads to even worse decisions. So data infrastructure and transparency are things that you all can focus on in Congress that aren't going to be political. And so if you do these things, in addition to recognizing the power of small wins, and Congressman Burgess mentioned this, you don't need to pass a sweeping bill to make a difference. A hearing, a letter, a clarification and guidance, a small appropriations change, voicing support for a community health center. These can all strengthen vaccine confidence in your community. And these are things you and your members can be doing right now, in addition to the oversight that is so important that you heard the two former members of Congress highlight.
Where are the sources for that information? If I'm a staffer, I'm a new staffer, do I go to the Department of Health? Where do I go to get that information about what my community's doing and what resources do they need?
My recommendation, and I want to
sorry.
hear from the other two docs too, but my recommendation is go to your state health department. Every state has one. And make sure you know the local or county health departments in your area, because they know too. Your staffers should be in touch with those people regularly because they know your most local information. And again, in Indiana, we're not nearly as big as Texas, but what's happening in Indianapolis is going to be very different than what's happening in Fort Wayne or Evansville. So important to get that local information. And again, your state health department will oftentimes have it, but you're going to get the best information from your local health department, in my opinion.
Yeah, and
Dr. Burgess?
your local health department, and of course, fortunate in Texas to have had good communications with the state Department of Health as well, both during COVID and during Ebola, because Ebola did affect Texas
Yep.
in a big way. And I guess part of the lesson there is you get through with one of these public health crises, and you got to remember there's probably another one around the corner. We just don't know what it is and what it's going to look like yet. So to simply discard all of the public health architecture, that's not a good idea because you're going to need it.
Dr. Bucshon, anything to add there?
No, I don't have anything to add. I agree with both their comments. I think it's a multitude of sources, but at the end of the day, it all congeals back to your state and local officials that know the information based on where you're located.
One thing that was in the headlines and it's dropped off a little bit is about measles and the ongoing outbreak there. We saw last month, or I guess it was actually in October, where Canada lost its elimination status, which means that measles is endemic. It continues to spread. It has spread continuously for 12 months in Canada. We know there's an ongoing outbreak in the US as well as in Mexico. The CDC recently announced that in the US, the outbreaks are linked, which is another step in terms of that we could lose our elimination status, meaning measles would remain endemic in the US. And we've held that status for 20 plus years. So it's sad. It's a sad milestone. We do still have an opportunity to stop it. But I wondered if those are things that you're looking at. Are there opportunities for Congress to weigh in and kind of help their constituents? Are we too far gone? Where are we on measles? Dr. Adams, do you want to start?
Well, there's always opportunities. As was highlighted earlier, one of the challenges is that in many cases uh, we're having fewer and fewer citizens who have experienced measles, who've experienced hospitalization. What's interesting about the Texas outbreak, and again, Congressman Burgess knows this better than anyone and can opine on this or talk or speak about this, but we had two children who sadly died, but we had dozens of children hospitalized from measles. It is not benign. Complications such as pneumonia, encephalitis, blindness, or death remain real, and we're seeing them in real time. And so I think, again, sadly, nobody likes to go in and get the oil changed in the car, but everyone's mad when they're stuck on the side of the road because the car is not running. Unfortunately, we're seeing more and more of the car stuck on the side of the road, and we need to tell those stories so that people understand there is real harm coming from us losing our eradication status. One of the things that I've been doing in my messaging is helping people see that we went from 95% measles vaccination just a few years ago down to 92%. And we have clear data that shows that when communities drop below that 95% threshold, you are at high risk for a measles outbreak. All it takes is someone coming in with a case of measles and it explodes like wildfire. And that's what we saw in Gaines County, Texas, where you had communities where the measles vaccination rates were down in the 80s. And so I think we need to tell those stories of harm that is occurring, not just death, but other harms that are occurring. Kids missing school. There was a study that showed that it was about $40,000 per case of measles for Texas to investigate and follow up on these cases. And so it's costing the state tremendous amounts of money to have outbreaks like this. And we're going to see more and more of that occurring in the future if we continue to see our rates dip.
And just to
I know it. Oh, go ahead, Dr. Burgess.
just to build on that concept, I mean, because it is a state that's affected in this case. I mean, you've got a political season just dead ahead in the state of Texas, and there are going to be lots of political arguments. But I promise you, if there's a rampant measles epidemic next March when our primaries occur, it could have a political, there could be political implications to that.
Exactly.
So clearly, our governor is going to be interested in what happens as far as the number of measles cases in the state and what happens as far as the number of other cases of other illnesses. But the public health implications actually then devolve down to a very local level, and it may have a political effect.
Yeah, I mean, I just want to reiterate again to the people on the call here that these are, and the other docs have said that these are not benign diseases. I think worldwide, measles is 1 or 2 in 1,000 deaths. I think it's somewhere in that range. Jerome, you probably know that better than me, but it's substantial. And worldwide, there's still substantial problems with childhood diseases in unvaccinated populations. You don't have to reinvent the wheel. You can look in areas of the African continent or other places where there's unvaccinated people and see what the downside of these diseases are. And the other thing to remember, I mean, a lot of people, as somebody has mentioned, think that these have been eradicated. Measles, if you look into it, they first identified something that could have been measles in like 500 AD. I mean, they've been following Infectious diseases that were thought to be probably looking back were a measles type infection for centuries. So these are not gone. And if you don't vaccinate people, they will come back and the statistics will catch up where you will have deaths and unnecessary deaths and other complications that have lifelong implications for people. I mean, I don't think we can say that too many times on this call.
Oh, great point. I did want to encourage people, if you do have questions, we still have some time. If you want to pose a question for our experts, please do so. I wanted to, one thing I just wanted to mention too, we talked about eradicating disease, and I know that Hep B was one that they were looking at potential for eradication over the next couple, 10, 20 years, that now we, had a setback there. But I'm also part of the generation, I have a smallpox vaccine scar. So I was one of those who was vaccinated against smallpox. My kids were not. And there's a reason for that because it works. And that was the first one that we actually eradicated. I know polio is one that's been targeted and is limited in terms of wild polio into certain parts of the world, narrow parts of the world. So there's some hope there as well. As we look ahead
And
for the
HPV, and again, it's another controversial one in some quarters, but you got places around the world that are close to eliminating new cases of HPV related cancer. And so, yes, we are getting more availability of vaccines now, and that's being portrayed as a bad thing in some circles, but it's correlating with less incidence of deadly diseases like HPV related cancers and like polio. And so I would encourage folks to remember what Dr. Bucshon said earlier, that these are not benign diseases that we're talking about preventing. And so you have to be thoughtful in weighing the one side or the one argument versus the other in terms of net benefit to society.
As we look ahead, and I'd like to end on a positive note too, and so I wanted to ask you, what gives you hope about rebuilding and sustaining public confidence in vaccines? And where do you think, what role can Congress play in helping to move those positive aspects forward and strengthen them?
Well, I'll start and let the two congressmen finish. What gives me hope is actually what happened in Texas. And what I mean by that is after we saw the unfortunate measles outbreak and unfortunately dozens of childhood hospitalizations and 2 deaths, what we did see is a big uptick in vaccinations. And so it shows that we can bring people to a place where they will vaccinate and increase their vaccination rates. And I hope that one of the things Congress can and will do is pay attention to those stories, pay attention to the rates, and use the Texas situation as a reason to move in the right direction, as opposed to waiting until you become the next Texas and have kids dying in your state before you work to get your vaccination rates up again. But I was hopeful, and I know you all were like, where is he going with this? I'm hopeful because after looking at what happened there, one of the things we see at the end of the day is that people, once they saw what was happening, did go and talk to their physicians and did get vaccinated. And we saw vaccination rates in many of those communities for measles actually tick up.
Great point. Dr. Bucshon?
Yeah, I mean, I think there's a lot of optimism. I think the one thing that we need to do and I'll give my personal view on this, at the federal level, is depoliticize this situation. I mean, the CDC, look, the CDC it has been one of the preeminent organizations in the world for decades, and it's been politicized. And now it's, the confidence level the American people have with the CDC is substantially lower than it was. And I mean, for example, I've been in favor, me personally, of a 10-year term director of CDC to try to attempt. Dr. Burgess may disagree, but try to attempt to depoliticize the agency somewhat. You still have to have executive branch oversight, and that person can be, terminated for poor performance. But But I think the flip-flopping politically at the federal level, both political parties need to address that and stop it. And I think that will happen. Until that happens, regaining the confidence of the American people for institutions like the CDC is going to be difficult. But I'm optimistic. I think I'm always optimistic about America because, no matter what challenges we face, we always seem to step up to the plate. And that's the American people, right? Through their elected officials that ultimately, I think, step up to the plate and lead the world in a lot of these issues. In that respect, I'm very optimistic.
Yeah,
Thank you, Burgess.
I would agree with that, and I hold out as an example Operation Warp Speed when Jerome was still in the administration. I mean, that was a phenomenal achievement. Every smart person who talked to us said, "Oh, it's 18 months if everything goes well, and nothing ever goes well. So you're years away from an answer to COVID." And yet we had one before the year was out. I mean, it's just absolutely a stunning achievement. Contrast that a little bit with the Ebola outbreak that happened in, what was it, 2013, 2014. And it took years to get what seemed to be a viable vaccine, the Merck vaccine, through the approval process at the FDA. The final approval for that actually occurred in December of 2019, like 5 years after it was actually needed. So yeah, we can do things, we can do big things in a hurry if we put our minds to it. Now, I'd also say, as far as the CDC is concerned, Larry and I were part of the Congress that required the CDC director to be Senate confirmed. A Senate confirmed CDC director was unknown prior to this year because of language we put into the Pandemic All Hazard Preparedness Act in 2019. And now you have a Senate confirmed CDC director to the last 4 weeks. So it was a little discouraging to me that actually transpired the way it did. The Senate being the greatest deliberative body in the world, I thought when they came to a conclusion about this person is okay, it might have a little more durability than the month. But Larry's right. If a way to depoliticize is to move away from the political process, I don't know how realistic that is right now. I mean, you got the Supreme Court about to make a decision that may make that even harder. But the key is, Larry's right. We got good people, and we always need to put good people in the proper position and keep after it till we get it right.
In terms of congressional leadership, and this is, as you mentioned, these diseases are bipartisan. It's a bipartisan challenge. It's a challenge for all of us. The diseases don't care who you voted for, if you vote at all, and they're serious. So, do you see a role for there's a Dem dot caucus, there's a GOP dot caucus. Is this an opportunity maybe to get the two caucuses together to lead on this issue, or where do you see that leadership coming from?
Well, historically, we did. Even before the Democrats formally organized into their own caucus, we would invite all congressional doctors. In fact, we had a presentation from.
You're frozen, Mike.
Yeah, he froze again. Dr. Bucshon, do you want to jump in?
Yeah, and I think he'll probably come back on. But yeah,
there he is.
There, Mike, you're back on. You were frozen for a while.
Oh, well, we did. We would collaborate even before there was a formal Democratic Doctors Caucus. We would collaborate on important issues, and yeah, to the extent that there can be more of that, I think that's a good thing. We do need to recognize that some of these things are going to be political and refractory to that type of solution. But I mean, we're doctors. We know how to do things.
Mm-hmm.
Yeah, I'll just agree with Dr. Burgess. I think we, as providers in Congress on big issues, like when we had the Secretary of HHS, we had Becerra, and I think during my last term, all the physicians on both sides of the aisle are invited to that discussion, right? So we've historically done that. There are areas of difference, legitimate differences on policy, but on one thing we're all together, and that's, do we want to make the health of the American people better? And whatever that takes to make it easier for providers to take care of people and improve the health of the American people, that goal we agree on and I think that there's opportunity on policy to come together and on some of these issues and solve some of the big problems.
Great point. So we're coming up on time. I want to give you each kind of 20 seconds for a parting shot. If people walk away with nothing else, what would you like them to walk away with today? Dr. Adams, can I start with you?
Well, I'd say that doctors remain the most trusted voices in America. With that trust comes a responsibility to communicate clearly and compassionately. And the more that we empower and enable our doctors and our nurses and our pharmacists to do that, the more we will see vaccine confidence continue to rise. And then just hitting the point that I made earlier, you have lots of levers as members of Congress to help improve vaccine confidence. One of those most important levers is your rhetoric. So make sure you are speaking in a way that engenders support in vaccines, trust in vaccines, and not that is facilitating the spread of mistrust or misinformation.
Great points. Dr. Bucshon, you want to go next?
Sure. I mean, I think the bottom line is trust your local providers and your state health organizations, and and recognize the fact that the federal government, as Mike pointed out, I think Mike pointed this out, there are no federal mandates in the vaccine space. So talk to your local doctor. And the other thing I think is I'm hoping that we get some politicization of healthcare at the federal level, and I think we can do that. So, constituents need to drive that. They need to suggest that to their senators and their House members. Hey, we want you guys to to be less political on these issues. But overall, I think I have confidence in the American people that we will come to the right conclusion on a lot of these issues. Just as Winston Churchill said many years ago, right? We'll explore all the possibilities and then we'll come to the right decision at the end.
Thank you. Dr. Burgess?
Yeah, I think it's important for people to recognize that in the public health space, you are operating in a new environment right now. And no one quite knows with the entirety what the parameters of that environment are. However, we also know that there continue to be infectious diseases and vaccine preventable diseases. And if you want to do the right thing by your constituents, you're going to encourage them to interact with their physicians who, again, I just reiterate, have their best interests at heart rather than a political agenda. But recognize you are in a new environment and it is a different world. So perhaps some of the things that have worked in the past are not going to work in this environment. But like Larry said, we'll always get to the right place, even if we have to exhaust all of the other wrong answers first.
All great points. Thank you so much for joining us. And a special thank you to our panelists, Dr. Adams, Dr. Bucshon, and Dr. Burgess, for sharing their expertise and guidance. The most important next step is simple. Keep connecting your constituents to local physicians. You heard that today. Tap into expertise in the public health professionals in your state and local communities who can answer questions and share guidance based on medical research and evidence and what's going on the ground. If today's conversation raised ideas or follow-up questions for you, please reach out to our team. We're happy to link you with resources. We're always available to support the important work that you're doing to keep Americans healthy. And we also have many helpful resources on our website, which is fightinfectiousdisease.org, and encourage you to take a look. Thanks again for joining us.